Welcome to Testable Faith. My name is George Haraxon. I get to serve here at Reasons to Believe as the Scholar Community Program Director. I also serve as a Senior Adjunct Professor in Philosophy and Ethics at Azusa Pacific University. And that will go towards our topic here today. We are here with visiting scholar, Dr. Chris Cirucci, and she's a visiting scholar here at Reasons to Believe, part of our scholar community. And we're going to be wrestling with the issue of abortion today. But let me just give a little bit of background on you so that those watching can know a little bit about your journey and your background. Dr. Chris Cirucci is a board-certified obstetrician and gynecologist. She received her MD from Jefferson Medical College in Philadelphia and completed her OBGYN residency at the Medical College of Virginia in Richmond, Virginia. She has worked for 20 years as an OBGYN physician in Pittsburgh, Pennsylvania, and has served multiple times overseas in various countries, practicing medicine as well and serving over there. So, Chris, welcome to Testable Faith. And we get to deal with a weighty topic, an important topic, and one that we want to provide space to dialogue about with people. And we're looking forward to having you equip us in this area. So the topic of abortion, as it comes up, one of the main questions, I mean, there's political questions, but we want to talk about more the ethical side and also the medical factual side of the issue as well. And if you ask the question, is abortion ever justified? Is it ethical? Or maybe you would rather phrase it, is it ever morally justified to take the life of the unborn human person? Just tell us your personal take on it.
Well, thank you, George, and thank you for that great introduction. It's great to be with you in person. So yes, abortion is certainly a hot topic, especially today. I believe that from the moment of conception, that one-celled organism is a precious human being made in the image of God. So I believe that not just by my faith, but also science informs that. So I believe that abortion is wrong. But let me go into that a little more. I think that most people, hopefully, would agree that killing an innocent human being is wrong. And abortion is killing an innocent human being. Therefore, abortion is wrong. And I really think it all boils down to that.
Mm-hmm. Now, I know on another program you were interviewed with one of our staff scholars, Dr. Fuz Rana, and you guys talked about sort of what is the human embryo, embryology, and some of those. Right. So we don't have time to get into those topics right now, although those are important. But you're pointing to the fact that it is a human being, it is a human, and science informs that. Sometimes you hear people talk about, or someone will say, well, it's a woman's choice, it's her body. How do you respond to those? Sometimes, they're on a sign, or it's a quick retort that someone will make. How do we honestly respond to that?
Sure, great question, because I think for those that are pro-abortion, that is often their main argument. This is my body, I have the right to do what I want, and you don't have a right to tell me what to do or whatever. So I think that is often the typical argument. So I would point to the basic principles of medical ethics, and there are 4 basic principles. There's justice, beneficence, maleficence, and autonomy. So beneficence is to do the right thing, to always do the good thing for the person. Maleficence is to not harm, do no harm, we often say in medicine. Justice is fairness, so I'm going to treat my patients fairly, treat them all the same. And the last one, autonomy, means that the patient has the autonomy. So if you have cancer and I, as a physician, recommend chemotherapy, you have the autonomy to say, no, I don't want that. And those are all important principles. So I think when a woman says, this is my body, my choice, they are calling on the principle of autonomy.
Mm-hmm.
The issue with abortion is that baby is a distinct human being. And so abortion is doing harm to that human being. So that brings in the principle of maleficence. And in that way, that will supersede the woman's autonomy, because that's actually not her person. That's not her. It's a separate human being.
Yeah, moral philosophers also talk about justice being treating equals equally.
Sure.
And so what I hear you saying is that the unborn are precious human beings, and we should treat human beings equally. They're a part of our human community,
Right.
and so we should treat them in that way, that they're valuable. So we're asking the question, well, what is it? If it's a precious human being and they're part of the human community, then you better have a pretty good reason
Right.
to why you would take that life. There was one other thing that you pointed out there. You mentioned autonomy and also choice. Moral philosophers also pointed out that the right to choose, or that choice, is an incomplete right. You have to fill in the blank of what you're choosing. Does that make sense?
Well, I think so. I think I have the right to choose, but that doesn't mean I go to a doctor and say, cut off my arm. Is that what you're talking about? Like, there's
Yeah.
a limit to
Yeah.
what you can choose. Or I can choose what kind of car I drive, but I can't choose to smash into every car I see. I'm simplifying it. You're the
Yeah.
philosopher, but
No. And I think, you're getting to the point. The right to choose, well, you have to fill in the blank. What are you choosing?
Right.
And then certainly you're pro-choice about choosing your car, your spouse, your home, all these sorts of things, the medical care that you receive. But in this case, we have to decide, well, what is the choice, and is that a morally beneficent choice in that case?
Right.
Now, some people are going to move to harder questions pretty quickly.
Sure.
And so we have issues where there's a pregnancy as a result due to rape or incest. How do you handle those more difficult, weighty questions?
Sure. And that's a very difficult question. And I just want to preface what I say with rape and incest. These are horrible, horrible traumas that women will carry with them the rest of their life. It's a horrible thing. The issue with abortion is abortion doesn't solve that trauma. It actually can compound the trauma. Abortion doesn't treat rape. It doesn't get rid of that. It doesn't. And another way I think about it is if a woman is raped, she is the victim and her baby is the victim. So why do we punish? Abortion would punish one of the victims and maybe two of the victims. We should be punishing the perpetrator. So again, abortion isn't a treatment for rape or incest. I don't want to minimize it because these are terrible things, but I also think that it's the wrong narrative to say, well, get an abortion and then move on with your life, because I don't think that doesn't solve that trauma.
It seems like also here we're dealing with not only a moral issue, but an emotionally or a psychological issues as well, and those get mixed together in a human person.
Sure.
So what would you say to this? You might be able to make a distinction that there are moral issues that we kind of know what the right thing to do is, but that doesn't make them not psychologically or emotionally complex. And what I'm kind of hearing you say is, in this situation, you might have a sense of what to do morally, but it becomes, in the cases of rape and incest, very psychologically and emotionally complex. Is that fair?
Sure. And I think that is often how the argument is discussed, is subjectively, like, well, what about this woman's poor or this situation? But again, if we're talking about a human life, then it doesn't minimize that horrible situation, but we're talking about a human life. It doesn't justify killing either.
How has you being OBGYN, treating women in this field, how has that impacted your pro-life position? How has it influenced it? How has it empowered it, maybe strengthened it?
Sure. Well, I think, first of all, I always learn from my patients. Every patient's different, and they all have their own story, and it's important to hear their story. I will say that through the years as I've practiced, one of the things we do is when we take a history is what we call an obstetric history. So how many pregnancies have you had? Your first pregnancy, was that a live born? Was that a miscarriage? So you go through what happened with each pregnancy. And I will say almost invariably, when a woman says, well, oh, that was an abortion, there's usually a change in her countenance, usually almost like she doesn't want to go there. And, I have to tread very carefully because these are things that women carry. So I don't think abortion doesn't serve women either. And they carry that for their lives. That's something I've seen.
What about in other cases you've obviously dealt with when you could be pro-life, but there's an ectopic pregnancy, there's a tubal pregnancy, right?
Sure.
Maybe talk about what that is, and then how you both as a physician and someone who's pro-life addresses those issues.
Sure. So an ectopic pregnancy is a pregnancy outside of the uterus, usually in the tube. It can be other places, but it's almost always in the tube. And the issue with an ectopic pregnancy is that it will continue to grow, and then the tube will rupture and the woman will bleed internally. So at this point in our technology, we do not have the technology to transplant that embryo into the uterus and save it. We cannot save an ectopic pregnancy. And if we do nothing, then the woman can die. Women have died of ectopic pregnancies. It's a medical emergency, and it's very interesting because there's been a lot of confusion since the overturn of Roe. But I'll speak before that, there was never any confusion about an ectopic pregnancy. Treating an ectopic pregnancy is not an abortion. I know no pro-life physician who will not treat an ectopic. So we can't save that baby. We have to save the mother. Now, after Roe was overturned, now we get this confusion of terms where somehow people are saying that's an abortion. I want to clearly say treating an ectopic pregnancy is not an abortion, and there should not be any confusion over that.
So you're saying, let me see if I've got this right, for an ectopic pregnancy, the intention of the physician would be, if you could save both lives, you would. We don't have the technology to save both,
right.
And so it's better to save one life than lose two in this particular case. Would that be a fair assessment of it?
Absolutely. Okay. And we just go back to how I define abortion. Abortion is the intentional killing of a preborn human. And again, in an ectopic, our intention is not to kill baby, it's to save the mother.
Right. But it does, the embryo or that, it does get killed in that particular instance, but that would be morally justified in this particular case. And you're saying, but that's not an abortion because it's not an intentional. If we could, we would try to save it.
Right. And I'm not also dismembering this baby. I am with this embryo. Again, there are different stages of development. We use different terms,
right.
But I'm not dismembering or, I think there is a dignity you give to this precious unborn human being. If I could save this human, I would, but we can't. Yeah. And if we did nothing, we would be doing harm.
Mm-hmm. Yeah, because we've talked about this on occasion. There's something called the SLED test.
Right.
What's the difference between the unborn and the born? And S stands for size, L level of development, E environment, and D degree of dependency. Right. And those different things, like size, for instance, doesn't change your human being status or that. What would you say about using the SLED test, and how does that impact you?
Sure, I've used it. I think it's a great way to look at things because why is it okay to kill a baby in the womb, but we would not, most people at least at this point, would not say you can kill an infant? Well, what's the difference? It's just what you went through. This is still a human being. We are not justified in killing.
Right. So that size, that level of development,
Right.
those aren't things that justify taking the life in this
Right.
in these particular cases.
Right. For example, an infant is a smaller size than an adult. That doesn't justify killing.
Mm-hmm.
It's at a different level of development. It's in a different environment. It's the infant depends on others.
Mm-hmm.
That doesn't justify killing.
Yeah. When we get older, we have different degrees of dependency.
Sure.
But we're still a full-fledged human being in those
Sure.
cases.
Exactly.
Shaq is bigger than my toddler, but they don't have
Yes.
different human rights.
Right. Right.
And that, boy, I want to ask you so many more questions. I
Go
do
ahead.
I want people just to remember that you had discussions with Dr. Fezrana
Yes.
on this topic as well.
Yes.
So there's more resources there. What kind of message would you want to leave us with as both a physician and someone who sees life as sacred and valuable from conception on?
Yes, thank you. Well, I think that you said it well. I mean, this is a precious human being. I want to clarify one more thing. 'Cause
Yeah.
We talked about ectopic, but the other topic that is getting confused these days since the overturn of Roe is miscarriage.
Oh, yeah.
Well, the medical term for miscarriage is spontaneous abortion.
You can see the
Because
definitions,
medically,
yeah.
abortion can mean loss. When we talk about abortion in our culture, we mean an elective abortion, an intentional abortion. A spontaneous abortion, or I'm going to use the word miscarriage, is not an abortion. The baby has already died. There is no reason that women cannot get treatment. And there's been a lot of misunderstanding, but yeah, I want to clarify that.
No, that's a really important distinction there, because you can easily go online and go to dictionary.com and look at abortion, and they will label not miscarriage, they call it a spontaneous
Right.
abortion. And you're making a very careful distinction here. In this particular case, the human embryo, or that has already passed on.
Right.
And so it's not technically an abortion
Right.
in this case. Did I get that
You
right?
did, yes. And then we also use that word abortion kind of in a couple different ways. And so we need to be careful about our terminology, but correct, yes.
Yeah, good, thank you. I really appreciate you making that distinction. If you want to hear more from Dr. Chris Cirucci and her other interviews with Dr. Fezrana and that, go to reasons.org and search for Chris Cirucci. And if you want to learn to spell her name, Cirucci, Dr. Chris Cirucci. So thank you so much, Chris, for being here and talking about these weighty issues. I hope that we'll be able to talk about them more.
Well, thank you so much. This has been my pleasure.